My name is Jennifer George. I'm an abdominal transplant and general surgeon. So I chose to become a physician because I was first exposed to healthcare through my mother. She was a registered nurse. She practiced for over 30 years and she's now retired. But when I was in high school, I would volunteer with her and I would see her interaction with patients and I would see the whole team and how they interacted with patients. And it kind of got me started thinking about entering into medicine. And that was my first introduction to what I could do as a physician. For general surgery, for whatever reason, I thought about the idea of doing something where I can physically work with my hands and something that required that kind of skill. Once I got into general surgery training, I was exposed to transplant because I trained at a level 1 trauma center, actually the one here in El Paso, and I was able to see how people became donors and how that surgery was done. And I met transplant surgeons through that experience. And I was able to travel around the country and see what transplant recipients look like. And that really put in my mind and in my heart the desire to want to work with transplant patients. And that's how I started that journey of getting into transplant. So since we do kidney transplants right now in El Paso, I deal with patients who have chronic kidney disease or end-stage renal disease. So those are patients who might have had diabetes or high blood pressure for a long time, or were born with some kind of autoimmune disorder or genetic disorder that places their kidney health at risk. And at some point when their kidney function is not great, their primary doctor or their nephrologist might say, you know what, now is the time to think about transplant. And when they have that conversation is when they're referred to see me. I see general surgery patients, so these are patients who have hernias that, are bothering them or, cause them discomfort and need to be repaired. Patients who have masses on their livers or their pancreas. Patients in the hospital who have appendicitis, so infections of their appendix. Those are just some of them. Patients who need access for dialysis, I'll see them too, who need peritoneal dialysis catheters. So wide range. If they have soft tissue masses, bumps on their skin that aren't comfortable, or they just want it removed because they don't like the way it looks, I can see those patients too. So wide variety of patients I'm happy to see. And if I don't, necessarily treat the thing they come to see me for, I can find someone who can help them. So I'm happy to see everyone. What I really like about being a surgeon specifically is that I can help someone deal with a very specific problem that's been bothering them. And one of the good things about doing a procedure is you can fairly quickly see the results of that. And maybe it's a little selfish, but it's the best thing about it is I can see a patient do a lot better in a matter of a week or two because of an intervention that we did. The other great thing is, even though we might have done a procedure at one time, I am that person's physician forever. So I want to maintain that relationship and see what's going on and how they're doing. And I'm always happy and open to see them later on, even if it's years down the line. Especially for my transplant patients, I tell them I want to be involved forever and I'm happy to see them, even if it's something that if they just want to come by and say hi. I tell patients that too. When you see me for your post-op appointment and everything's going great, I'm happy to see you if you just want to stop by and say hi, just to know and, see how you're doing. So I think it just affords, an opportunity to see someone not just as a patient, but as a person. And just, I get very invested in seeing them do better. It brings me a lot of joy. So yeah, so I'm from New Jersey, which is very different than El Paso. The reason I ended up in El Paso in the first place was for my surgery training. It's when you are going through the process of deciding where to do your training, it can be luck of the draw. So I consider myself lucky that I ended up in El Paso, and that was my introduction. And I spent 6 years here as a surgery resident, getting acquainted to the community. And I really love the people. Everyone is so nice. It is different. If you're from the Northeast, you know how the personality is. It's very different when you come down to the South, and it's nice and refreshing. The other thing is there is a need in the community for certain specialties that, aren't easily accessible. Transplant is definitely one of them. And I knew I was going to go into transplant, and they at the time had really one transplant surgeon and 2 nephrologists. And I really I saw the need for kidney transplant and transplant in general here because not everyone has the luxury of being able to travel to Dallas or to Phoenix to get their medical care. And if something happens, they have to go all the way back over there to get help. So it's just so much better to be able to stay at home and get your care here. And that really motivated my decision, seeing that there were so many people that needed the help and having the ability to even help out a little bit, it really made me want to come back here and practice. I do like to hike. The funny thing is I have hiked more in New Mexico than I have in El Paso, but I do like to hike. So in the weekends that I'm not on call and I'm not working, then I'll travel to go to different national parks and do some hiking. And I really like eating, so I will travel around the country to try different restaurants and cuisines. I haven't translated that into cooking for myself, but I do enjoy other people cooking for me. So I will travel to eat very good food, but eating and hiking. So those are the two. So I do want to make people aware that I do the kidney transplants, I do the living donor surgeries, but I also am a general surgeon, and I do have an interest in kidney surgery and liver surgery. Kidney, liver, and pancreas surgery. So if they do have a mass or an issue with their liver or pancreas that's not transplant related, I'm more than capable and happy to help navigate their care through that. And any general surgical issue that they have, hernias, lumps and bumps, that are bothering them, I'm happy to help them with that as well. Their gallbladders, happy to help with that as well. So.